if you're over 60 and wondering whether it's still safe, or even normal, to masturbate, you're not alone. In fact, many men at this stage of life still enjoy healthy sexual expression, but there are a few important things you need to know. I'm a urologist, and today, I want to gently guide you through 3 common mistakes older men often make, and how to avoid them, so you can stay safe, confident, and connected to your body. Your health matters, and so does your comfort. As we grow older, creating a safe, private, and relaxed environment becomes even more important when it comes to self-care, including masturbation. Many men over 60 may feel hesitant or unsure about their bodies, and that's completely normal. But one of the best ways to support healthy, safe self-pleasure is by setting up the right space and choosing the right time. Let's start with privacy. Whether you live alone or with a partner or family, it's essential to find a quiet, uninterrupted time where you feel completely at ease. When you're relaxed, your body is more responsive, your muscles are less tense, and your mind can focus on comfort and enjoyment. Stress and distractions can lead to rushed or even rough habits, which increase the risk of irritation or injury, especially for aging skin. Next, consider your physical comfort. Choose a comfortable place where you can sit or lie down without straining your back, hip joints. Many older adults live with arthritis, stiffness, or other mobility concerns. Supporting yourself with cushions, warm blankets, or even a heated pad help create a soothing environment that encourages gentle and mindful touch. Lighting and mood also matter more than you might think. Harsh lighting or a cluttered space can make you feel self-conscious or rushed. Try dimming the lights, turning on relaxing music, or simply closing your eyes to feel more present and connected. Masturbation, especially in older age, is not just about the act. It's about how it makes you feel emotionally and physically. Another crucial factor is timing. Many seniors find that their energy levels and mood vary throughout the day. Try choosing a time when you're well rested, not hurried, and feeling relatively calm. For some, that might be in the morning after waking up. For others, it may be in the evening after a warm bath. The key is to listen to your body and honor its natural rhythms. Finally, don't underestimate the importance of mental readiness. If you're feeling anxious, guilty, or unsure, it can affect your experience and even your physical response. Know that masturbation is a completely natural and healthy activity, even after 60. In fact, it can support relaxation, improve sleep, relieve stress, and even promote better circulation. In summary, choosing the right environment and time is not about making things complicated. It's about setting yourself up for a safe, pleasant, and respectful experience. As your urologist and health guide, I want to remind you this is your body, and you deserve to feel comfortable and in control of it at every stage of life. As we age, our bodies go through many natural changes, including changes in how we feel touch, pressure, and arousal. One of the most important things for men over 60 to understand is that sensitivity often decreases with age, and that's perfectly normal. Recognizing and adjusting to this shift can help you avoid frustration and prevent unintentional injury during masturbation. Let's start with what happens physiologically. With aging, there is often a gradual drop in testosterone levels. This can lead to a reduced sex drive and less intense physical sensations. Nerve endings may also become slightly less responsive, and blood flow to the penis might not be as strong as it once was. As a result, it may take more time and stimulation to become fully aroused or to reach orgasm. This slower response is not a sign that something is wrong. It's simply a sign that your body needs a bit more patience and care. The mistake many older men make is trying to rush the process or apply excessive pressure in an effort to feel something. But this approach can lead to skin irritation, bruising, or even small tears, especially since the skin in that area may be thinner and more delicate with age. Instead, the key is to go slow and explore what feels good now, not what used to feel good 20 or 30 years ago. You may find that different types of touch work better now. For example, lighter, circular motions or the use of a warm, moist towel may be more comfortable than firm pressure. Try experimenting gently and give yourself permission to adapt. There's no right way, just your way, as long as it's safe and respectful to your body. In some cases, erections may not be as firm or long-lasting as before, even with arousal. This is also common with age. Don't let this discourage you. Remember, the goal of masturbation doesn't have to be orgasm. It can simply be about pleasure, relaxation, or connection to your body. Reframing the experience in this way often helps take the pressure off and increases enjoyment. Another tipping: if you've noticed reduced sensation, it might be helpful to avoid distractions and focus fully on the moment. Turn off the TV or put your phone on silent. This helps your brain stay more connected to your body, which can naturally boost arousal and awareness of touch. In summary, understanding and honoring your changing sensitivity is an important part of staying safe and satisfied. Your body is different now, and that's okay. Treat yourself with patience and care, and you'll find that intimacy and pleasure are still very much within reach, even after 60. As your urologist, I want to reassure you're not broken. You're just evolving. And that's something to embrace, not fear. One of the most common and risky mistakes men over 60 make during masturbation is using too much pressure or overly aggressive techniques. As we age, our bodies require gentler care, and that includes how we touch and stimulate ourselves. What may have worked in your younger years might not be safe or comfortable anymore. Let's talk about why this matters. As men get older, the skin on the penis becomes thinner and more delicate. There may also be a decrease in natural elasticity and hydration. This means it's easier to cause irritation, bruising, or even tiny tears if you're too rough or apply too much force, and because sensation may be reduced due to aging nerves or circulation. Some men unknowingly overcompensate by gripping too tightly, often called the death grip. While it might feel like you're trying to make it work, this habit can do more harm than good. Another concern is that repeated aggressive movements can lead to temporary nerve desensitization or even long-term damage over time. You may find that your sensitivity decreases further or that it becomes harder to respond to other forms of stimulation, including during intimacy with a partner. In some cases, harsh techniques can also contribute to soreness, inflammation, or swelling after the act, which can be uncomfortable and worrisome. So, what's the solution? Gentleness and mindfulness. Choose a slower pace and experiment with lighter strokes. Focus on how your body responds rather than trying to force an outcome. Remember, there's no rush. Take this time for yourself as a form of self-care, not just release. You might also consider varying your touch. Try open hand stimulation, gentle circular movements, or even using the palm instead of a firm grip. If you're struggling to feel enough stimulation, try using lubrication to enhance sensation and reduce friction. We'll go into this more in the next section. Lubricants can help you achieve more pleasure with less effort, keeping your skin safe and improving your overall experience. Warm water or a warm washcloth can also add comfort and relaxation to the process. It's also important to watch for signs of irritation or discomfort after masturbation. If you notice redness, stinging, or lingering soreness, these could be signs that you're being too rough. Give your body time to heal, and don't ignore warning signs. Your skin and tissue need time to recover, just like any other part of the body. In summary, masturbation after 60 should be a gentle, respectful act. Avoiding excessive pressure protects your skin, nerves, and long-term sexual function. You've earned the right to slow down, to treat your body with care, and to enjoy healthy self-pleasure safely. As your trusted urologist, I want to remind you, pleasure should never come at the cost of your comfort or safety. As we age, one of the most important yet often overlooked aspects of safe masturbation is the use of lubrication. Many older men grew up without being taught how or why to use lubricant during self-pleasure. But after 60, it becomes not just helpful, but essential for protecting your skin and enhancing comfort. Let's begin with the why. With age, the skin of the penis becomes more delicate and prone to dryness. This is completely normal and happens due to changes in circulation, hormone levels, and skin elasticity. When the skin is dry, friction from masturbation can cause irritation, redness, or small tears, even if you think you're being gentle. These tiny injuries can become uncomfortable or even lead to infection in some cases. Lubrication helps by reducing friction. It allows your hand to glide more smoothly over the skin, making the experience more pleasant and far less likely to cause any irritation. Even if you've never used lubricant before, it's worth giving it a try, especially if you've been experiencing soreness, tightness, or discomfort afterward. There are several types of lubricants, and it's important to choose one that's safe and effective for your skin. Water-based lubricants are gentle, easy to clean, and widely available. They're a good all-purpose option, especially if you're new to using lube. The Chi-S silicone-based lubricants last longer and are great if you need more glide without reapplying. They're ideal for longer sessions but can be harder to wash off. Avoid oil-based products like baby oil, petroleum jelly, or cooking oils. These can irritate the skin and increase the risk of infection, especially for sensitive tissue. Make sure you read the label and choose products that are fragrance-free, non-irritating, and designed for genital use. If you have sensitive skin, opt for products labeled hypoallergenic. Before starting, apply a small amount of lubricant to your hand and gently rub it on the penis. Add more as needed. You'll likely notice that everything feels smoother and more comfortable right away. If you experience any burning or itching, stop and try a different formula. Some men feel hesitant or unsure about using lubrication, especially if they've never done so before. But remember, it's not about weakness or needing help. It's about respecting your body's changing needs and doing what's best for your health. Just like you use reading glasses or joint support, using lube is a smart way to support your comfort and safety. In short, lubrication is a simple, powerful tool to make masturbation after 60 easier, safer, and more enjoyable. It protects your skin, enhances sensation, and helps you avoid discomfort. As your urologist, I strongly recommend making it a regular part of your routine. Your body deserves gentle care, and using the right lubricant is one of the easiest ways to provide it. As men age, it becomes increasingly important to pay attention to the health of the prostate and urinary system, especially when engaging in activities like masturbation. While self-pleasure is a normal and healthy part of life, even after 60, it can sometimes reveal or irritate underlying issues that shouldn't be ignored. The prostate gland, which plays a role in semen production, often changes with age. It's very common for men over 60 to experience benign prostatic hyperplasia (BPH), a non-cancerous enlargement of the prostate. This can put pressure on the urethra and bladder, leading to symptoms like frequent urination, weak urine flow, difficulty starting or stopping urination, or the feeling of incomplete emptying. When masturbating, these issues can sometimes become more noticeable. For example, you may find that your ejaculation feels weaker, or that you have some discomfort or dribbling afterward. These may be early signs of prostate enlargement or other urological conditions. In some cases, men may even feel a dull ache in the lower abdomen, lower back, or between the legs during or after climax. Another concern to be aware of is prostatitis, which is inflammation of the prostate. It can cause pain during ejaculation or urination, and sometimes comes with fever or fatigue. This condition may be caused by an infection or prolonged irritation. If you experience sharp pain or ongoing discomfort during or after masturbation, it's important not to ignore it. The urinary system can also become more sensitive with age. Masturbation should not cause pain, burning, or blood in the urine. If it does, these are red flags that need medical attention. Similarly, if you notice any changes in urine color, sudden urgency, or nighttime leakage, these symptoms could indicate an issue that's not directly related to masturbation, but is worth discussing with your doctor. It's also helpful to keep an eye on how long it takes to ejaculate or whether climax feels satisfying. A significant change in these experiences may not be cause for alarm, but if you notice patterns that feel unusual or concerning, it's a good idea to check in with a urologist. Here's the good news. Many of these issues are manageable with early detection and the right treatment. Regular checkups with your doctor, including a prostate exam and urine analysis, can help keep things on track. Being proactive and honest about your symptoms allows you to maintain not only your sexual health but your overall well-being. In short, masturbation can be a useful indicator of your health. If something doesn't feel right, whether it's pain, pressure, or changes in ejaculation or urination, don't ignore it. As your trusted health consultant, I encourage you to see your body as a guide. Listening to it, especially after 60, can help you catch concerns early and stay safe, confident, and in control. Masturbation is a private and personal part of life, but that doesn't mean you have to manage every concern on your own. Especially after 60, it's important to know when to seek professional advice from a urologist. Doing so can help you stay healthy, prevent complications, and feel more confident in your body. Many older men feel hesitant or even embarrassed about bringing up topics like masturbation, erection changes, or ejaculation problems during a doctor's visit. But the truth is, urologists are trained to deal with exactly these kinds of concerns. Nothing you say will surprise or embarrass us. In fact, having an open conversation with your doctor can be one of the most powerful steps you take toward maintaining your sexual health and comfort. So, when should you talk to a urologist? Start with any pain or discomfort during or after masturbation. Whether it's in the penis, testicles, lower abdomen, or pelvis, persistent discomfort is a signal that something needs attention. Even mild but recurring soreness could be a sign of inflammation, infection, or pressure related to an enlarged prostate. Next, watch for changes in your erections or climax. It's normal for erections to be softer or slower to develop with age, but if you notice a sudden drop in function, a complete loss of sensation, or difficulty reaching orgasm, it may be time for an evaluation. Sometimes these changes are related to circulation or nerve health, and early treatment can often make a big difference. Also, talk to your doctor if you experience urinary symptoms such as frequent urination, difficulty starting or stopping your stream, nighttime urgency, or leaking. These issues may seem unrelated to masturbation, but they often point to changes in the prostate or bladder that can impact your sexual well-being too. Another reason to consult a urologist is if you notice blood in your semen or urine, a new lump or swelling in the testicles, or unusual discharge. These signs may feel alarming, and rightly so, but don't panic. In many cases, they have treatable causes, especially when caught early. Even if you're not currently having any problems, consider making regular checkups with a urologist part of your routine health care after age 60. These visits are a chance to discuss your concerns, get a prostate exam, and receive guidance that's tailored to your body and lifestyle. Remember, masturbation is not something to be ashamed of. It's part of your personal health. And so is knowing when to ask for help. Reaching out to a urologist doesn't mean something is wrong. It means you're taking responsible steps to stay well informed and safe. In summary, talking to a urologist is one of the best ways to ensure that your body continues to serve you well, especially when it comes to intimacy and sexual health after 60. As your trusted health partner, I encourage you to speak up, ask questions, and get the care you deserve. Your health and your peace of mind are worth it. Your body is still yours to enjoy, no matter your age. Safe, informed self-pleasure is part of good health, especially after 60. If you found this helpful, please give the video a like and share it with someone who might benefit. And don't forget to subscribe for more trustworthy, senior-friendly health guidance from a urologist who truly cares. You deserve clear answers and good health every step of the way.